Hi, everyone. I'm Dr. Tom Oswald, and I work here at the Tampa VA. I'm going to spend just a couple minutes talking to you guys about the inpatient rehab neuropsychology rotation as part of our internship training program. This is a rotation that is run by myself as well as Dr. Tracy Kretzmer. We are both neuropsychologists that sort of specialize in this inpatient rehab setting. The rotation here is required for all neuropsychology track interns. However, it's also open to all interns if you're interested in more of the psychological adjustment to disability piece commonly seen in rehab settings. And to further entice you to come to Tampa, the photo in the background there is our actual rehab facility, and all the photos in this presentation are stock photos of the actual facility. So on this rotation, our goal is to expose you to the duties consistent with a neuropsychologist working within an intensive inpatient rehab setting. So that's going to include initial intake assessments, adaptive neuropsychological evaluations, anything from an orientation log to serial monitoring to brief evaluations to full-blown comprehensive evals common to the outpatient clinic. We will provide teaching and practice with behavioral management and environmental modification. We do engage in supportive psychotherapy to address adjustment to disability. We will also integrate you into family education groups and team consultation. The rotation covers two different rehab units, the primary one being the TBI polytrauma unit as part of the polytrauma system of care. We are the rehab center in the southeastern region for this system of care. So as you can see here, each room is private. There are 18 of them, and it is a locked unit, staffed with a full interdisciplinary team. So that includes the physiatrist, nursing, PT, OT, speech therapy, neuropsychologists, as well as more creative minds like recreation therapy, creative arts, virtual therapy, pool therapy, vision therapy. We have a adaptive technology technician, and I could keep going on, but there's a really smart integrated staff here that works to help our patients recover. The majority of patients on this unit are here for moderate or severe traumatic brain injury, including a disorder of consciousness like minimally conscious or vegetative state, or possibly still in the post-traumatic confusional state, as well as some higher level brain injury patients. However, we also provide services to stroke patients, individuals recovering from a brain infection or after surgery to resect a tumor. And sometimes we have individuals that are just here to treat pretty severe polytrauma physical injuries. They require our level of nursing care, so we'll provide services to them as well. This unit does serve veterans as well as active duty service members. So that's an interesting addition to this unit, is working with military personnel and understanding that culture. And patients are usually 18 and older. There's usually a younger crowd that are at increased risk of getting brain injury, as well as the older individuals that may be here for strokes or other health-related acquired brain injuries, as well as falls and things of that nature. As you can see in the photo here, there are two levels to this part of the rehab center, and we cover both. So on the second floor there is actually our general rehab unit. That is a 19-bed unit. It is not locked, and patients are primarily there following some orthopedic surgery. So total hip replacement, total knee, fractures after an accident, amputation, COVID-19 recovery, or possibly recovering following a prolonged hospital course or a complex medical issue, and now they're quite deconditioned. Again, there's a full interdisciplinary staff on each floor, and the general rehab unit is usually veterans only and typically older in age as far as patients go. So for our last slide here, I'm going to try to address some common questions that we frequently get. So a day in the life of is a common question, and that is hard to answer. So flexibility is usually the word I go with. Practicing flexibility in time management skills and scheduling skills, flexibility even within the neuropsychological assessment that you may give. We may have to adapt a lot of those measures to meet our patients' needs and limitations, particularly in an acute setting. Speaking of acute, we do see a lot of those acute syndromes, or maybe things that you read about in textbooks but don't always see in the outpatient clinic. We see a lot of individuals with aphasia, with visual field cuts, with left neglect, with a lot of frontal lobe dysfunction, disinhibition, impulsivity, sometimes a lot of agitation, irritability. And we'll teach you how to track all of that. The reason I bring that up is it really enhances knowledge of brain behavior relationships, being able to look at neuroimaging and then see the patient suffering from those acute effects. And then how do we capture those effects with the available neuropsychological measures that we have? So it kind of helps us really connect all of those pieces together on this rotation. I'm always asked about caseloads. Again, that is quite hard to answer. Flexibility is key. However, if I have to average, let's say 4 assessment cases at a time, they are not full-blown comprehensive assessments, but you might be serial monitoring one patient, doing behavior management with one patient, doing a full battery with one, and maybe a shorter battery with another. And then usually one intervention case just to practice those general psychology skills while in the setting with someone with cognitive impairment. We do supervision. Obviously, individual supervision is required. We will also do group supervision, where we will review articles, talk about cases, and talk about topics of relevance depending on the patients that are here. And then lastly, the team is consisting of myself and Dr. Kretzmer. We will be the 2 staff neuropsychologists for this rotation. There is always one neuropsych postdoc on this rotation. And then depending on the timing and time of year, there may be one rehab psychology postdoc, and then there might be one intern. Again, this is required if you are on the neuropsychology track, and it is open to any intern as long as you can fit it into that rotation schedule. Hope this information was helpful. I look forward to meeting some of you and answering even more questions. At the end of the day, I wish you the best of luck in this internship process.